Good evening everyone, how are you? Hope you are doing good. I am Dr. SULTHAN and RASHID, consultant diabetologist at Ammaar, Chennai. Today I am going to talk about one of the important topic, that is recommendations for the patients with diabetes mellitus during the hajj pilgrimage. Let's go into the topic. Hajj is one of the main pillars of Islam and it is mandatory for all adult Muslims who can afford the journey and are in the acceptable health. Over 2.5 million pilgrims gathered from different nationalities perform this pilgrimage in Saudi Arabia in the lunar month of Hajj. Significant proportions of those performing the Hajj are elderly and may suffer from chronic medical conditions. Considering the 10% prevalence of diabetes mellitus in this age group, about 250,000 diabetic patients will participate in this crowded pilgrimage. Many of them are also suffering from diabetic complications like eye or coronary heart disease and diabetic foot. The Hajj duties can be demanding in terms of physical activities and mental effort. Due to a lot of changes in the usual life of diabetic patients during the Hajj, for example, geography, weather, diet, and physical activities, they are more prone to a real challenge. Increasingly, diabetes has been reported as a leading cause of morbidity and mortality during the Hajj. And a special part of the Hajj duties, that is during the Ihram, some acts are forbidden for the pilgrims, including the blood extraction. This can affect the self-monitoring of the blood glucose by glucometer. Some diabetic patients are at higher risk for morbidities during the Hajj. They include people with the poor glycemic control or severe and recurrent episodes of hypoglycemia and unawareness, recurrent ketoacidosis and hyperosmolar state, and advanced diabetic complications like renal disease. Patients with multiple daily insulin injections or sulfonylureas are also prone to some problems. Here are some recommendations for diabetic patients and their medical teams before and during this valuable spiritual pilgrimage. Let's see what are they. Before travel, the patient should try to have a very good control of diabetes mellitus. Their blood glucose should be in control and their blood pressure should also be in control. Inform the caravan manager about your disease and medications. Prepare a checklist of mandatory requirements. Complete your recommended vaccinations, including influenza and pneumococcal vaccines. Prepare adequate medications and place them in separate containers. If possible, prepare a cool pack to store your insulin. Prepare glucose and ketone dipsticks to know the state of diabetes control during the Ihram. Choose shoes, sandals and flip-flops with appropriate shape and size. The front of the shoe should be wide enough to avoid extra pressure on your feet and toes during the long walking. Pack your medications in carry-on luggage rather than the checked baggage. This is not only to prevent the loss from the bags being misplaced, but also because baggage stored in the cargo holds can be subject to extreme temperature changes that may alter the potency of the insulin. So you should store your medications in carry-on luggage. So during the travel, what you have to do? Always carry some carbohydrates to be used in the hypoglycemic states, for example, honey, jam, etc. Try to adhere to a healthy balanced diet containing adequate but not excess carbohydrates with appropriate proteins and fiber but minimal monounsaturated fats. Use as desired vegetables and 2 units of fresh fruits per day but avoid fruit juices and syrups. Drink at least 8 glasses of water daily and carry enough water bottles with yourself. If you use insulin before Ihram, check your blood glucose by glucometer and urine ketone by dipstick. If needed, use a small dose of insulin to cover hyperglycemia or some bread for hypoglycemia. If you use insulin before and during long walking, decrease the dose of the short and intermediate acting insulin about 20%. If the patients are on sulfonylurea drugs, example glibenclamide, the small decrease up to 50% decrease in the corresponding drug dose can also be applied. Before tawaf and say walking between the Safa and Marwa, consume some extra carbohydrate. Bread is more preferred. Walk slowly during the tawaf and sa'i and try to protect your feet from the damage by the ground tiles or the other pilgrims. In case of fever, diarrhea, vomiting or any other acute medical conditions, consult your medical team promptly instead of waiting in your residence. Although challenging to diabetic patients, by good planning and pre-travel consultation with your medical team, this nice spiritual pilgrimage can pass safe without major health consequences, inshallah. Thank you so much for your kind attention and kindly share my lecture to your friends.